I would ask, and I apologize, I don't, Ms. Politz, and I'll just go, from one end of the panel to the other end, because I obviously will run out of time. I'd like to have your reaction to this.
Actually, if you wouldn't mind, Congresswoman, I would defer to Dr. Holahan. I know they're doing some research on options for funding health.
Okay.
Well, that was a pretty amazing list. I think some of those things have to be on the table. I think what we call sin taxes, I think a cap at probably starting at least at a high level on the employer exclusion, and some of the other things that you mentioned. And we should exploit all the possibilities for savings that we can, including trying to reform the way we deal with chronic illness. I just want to make a point, because the issue of the cost of reform has come up several times. There is a huge cost if you do nothing. We published a paper about a month ago called Health Reform, the Cost of Failure. If there is nothing, no reform, the number of uninsured could go up into the mid-60s, 65 million roughly, in the worst case. The employer-sponsored coverage will drop quite a bit. The number of people going on in Medicaid will expand. That's a cost to government. The number of uninsured will mean more uncompensated care. That will have to be financed. Employer spending...
Sir, did you miss the part about 120 million will lose their coverage under the proposed plan?
No, that's not possibly right. That is ridiculous.
That's not possibly right.
It's ridiculous.
You think it's ridiculous? Well, sir, I really think that employers will be dropping their plan because the 8% may be...
But they offer now when they pay no penalty, right?
If they offer now, there's still a question about if someone is covered by the spouse's plan and also the percent that they cover of the employee's plan. So I think we need to be very careful where we go with this.